More than 35,000 women with either pre-existing or gestational diabetes mellitus give birth in England and Wales every year. Around 90% of these pregnancies are in women with gestational diabetes mellitus. However, the number of pregnancies in women with type 2 diabetes is increasing. These women with type 2 diabetes tend to be older, more overweight, and come from more socially deprived backgrounds. The prevalence is higher in those of Asians that account for 70% and Black origin that account for 90% compared with 30% of women of white origin. If not well managed, pregnant women with diabetes will face an increased risk of adverse outcomes including miscarriage, preeclampsia, surgical delivery, and acceleration of pre-existing diabetes complications. However, babies born to mothers with diabetes are facing an increased risk of preterm delivery, birth trauma, and neonatal death. Additionally, new evidence suggests that offspring of diabetic mothers are more likely to be obese as children and develop type 2 diabetes later in life. Diabetes during pregnancy poses a risk to both the mother and the developing fetus. Pharmacists and healthcare providers must be prepared to support and educate women who are planning for pregnancy as well as those who are already pregnant to help them manage their diabetes. All pregnant women of childbearing age should be educated by healthcare providers on how to live a healthy lifestyle and should be counseled about the importance of tight glycemic control prior to conception. Pharmacist's role is implemented in the management of hyperglycemia during pregnancy. In the clinical pharmacist assessed program of optimizing drug therapy and intensive education on main management outcome, measures the patient knowledge about diabetes quality of life as measured by survey including maternal complications, fasting plasma glucose control, and hemoglobin A1C. Pharmacists could help prevent drug-related problems by assessing the likelihood of fetal exposure and reviewing prescriptions to identify any drug errors and potential drug interactions as drug-food or drug-herb interactions. Contributory factors to poor outcomes in pregnancies with diabetes as maternal social deprivation and older age are the most significant factors, along with the unplanned pregnancies, smoking, poor perinatal care, pre-existing diabetes complications as nephropathy, lack of preconceptual folic acid supplementation. However, despite the knowledge of the potential risks, recent data from the National Pediatric Diabetes Audit shows that women continue to be poorly prepared for pregnancy because of the poor care and counseling. Community pharmacies are ideal places to offer advice on pre-pregnancy planning. Pharmacists have a unique role as accessible healthcare provider to optimize preconception health by screening women for tobacco use and appropriate immunizations through medication screening of chronic disease state management such as diabetes, and preconception planning to aid women in preparing for healthy and safe pregnancies. Preconception advice and care delivered by a multidisciplinary team, especially clinical pharmacists, is advocated as gold standard because early planning allows optimization of diabetes as to ensure good glycemic control before and after conception, and is associated with a 75% decrease in congenital malformations and 66% decrease in perinatal mortality recommended by the 5th International Workshop Conference on Gestational Diabetes Mellitus. Women should be encouraged to discuss with their pharmacists and other healthcare providers if planning pregnancy, and to discuss any pre-existing health conditions or long-term medicines taken. All women with pre-existing diabetes planning a pregnancy should be offered self-monitoring blood glucose and monthly hemoglobin A1C measurement and review, ensuring enough testing strips and lancets are provided, especially to women on multiple daily insulin injections. The desired targets for blood glucose levels should be as follows. For more information, you can visit our website through the link provided in the video, where it covers all information that the video covered and even more detailed. Thanks for watching and happy Diabetes Day.